All right, and finally tonight, I kind of want to wrap up with someone you should know. Have you both met Monique Stanton? She's the CEO of CARE of Southeast Michigan. Have you met her before,
No,
Nolan?
I haven't.
She's really interesting. I met her a couple of years ago when she got a leadership award. You remember you and I both emceed that event.
Did. Yeah.
And she's really passionate about linking people up to services that they so desperately need, especially when it comes to addiction treatment.
Yeah, opioids in Macomb County, huge issue statewide, but especially in that county.
And what's really interesting is she's driven, the work that she does, it drives her every day because of an experience that she had as a young person growing up. Take a look. Monique Stanton is someone that you should know.
Okay, so I'll scooch over.
Perfect.
Okay,
All right,
great.
good.
Thanks,
Thank
Mary
you.
Jo.
Monique Stanton heads up CARE of Southeast Michigan, headquartered in Fraser in Macomb County, steering a staff of 100, focusing on some of the toughest and personal struggles people face and connecting them to the help they need.
We start with early childhood programs, we offer school-based education services, and then services to help parents, adults, and even the senior community, really to help people address substance use. And in Macomb County last year, we lost 380 lives to overdoses.
You guys just got the numbers on
We just
that.
got the numbers, and most of them were really around opiates, and whether it's fentanyl or heroin.
On the front lines of the opioid epidemic and helping families caught in the fallout isn't just a job.
And then over here is our prevention staff.
Monique knows exactly what it feels like.
My mother really struggled with a heroin addiction for much of my childhood. I'm proud to say she now has over 15 years of recovery time. But for me, that was really difficult growing up and not knowing, is the next call going to be somebody saying that my mother was in jail? Was it her saying, I need some money? Or was it going to be the call saying that she was dead? And then there would be periods of time where we wouldn't hear from her for a month, and you're just worrying.
How old were you when you first realized that your mom had an addiction problem?
I was probably about 12, 13-ish. She struggled when I was young, so a toddler, and I lived with my grandparents for a period of time, and she relapsed after my adopted father had gotten cancer. She started abusing his pain medication, and then after he died, she got connected and started using heroin.
It wasn't an easy journey, but factors into Monique's decisions each day. For the past 10 years at CARE, 6 as CEO, promoting programs in hospitals, prevention outreach, working with kids, and making sure people get access to treatment as quickly as possible.
We're at St. John Murrah, St. John Macomb, Henry Ford Macomb, and soon to be McLaren Macomb. And so when somebody comes into the emergency room and they're struggling with alcohol, with opiates, maybe they're seeking medication or experienced an overdose, they get connected to our peer recovery coach. And it's a person that's able to have a conversation with them about their drug use or their alcohol use that's been there. I remember going into emergency rooms and seeing the disdain from the medical community about her and what her choices were and how they treated her. And so for me, that's instilled, we really need to treat people with dignity. We need to treat people with respect, because that's a human being that's really in life's worst circumstances sitting there right there.
I just need to see if I can get a copy of your driver's license so I can give it to Liz.
What is a day like when you leave the office here and you shut the door and go, all right, today was a victory? What does that look like?
Sometimes it's hearing about a person that's come into services maybe multiple times, and they're finally making it, and they're finally graduating for a new program, or being able to get their kids returned because their kids were in their child welfare system, or hearing some of the stories about people that maybe have come into services and they're finally doing well. We get calls sometimes from kids that have come through our camp that now want to be social workers, and they want to contribute back to the community. Part of what I believe, and part of what my mom believes and demonstrated through our work, is that recovery is possible, and it takes work. It's hard, it's difficult sometimes to rebuild those relationships, but it's definitely possible. And we talk a lot about how many people have died from addiction, but there are 24 million people in the United States that are in recovery. And so there's hope, even in life's darkest hour.